Hello and welcome to Medicare 360. I'm Jennifer Alfonso Lee, and today we're going to have some fun while discussing a very serious topic. Over the past 20 plus years in the insurance industry, I've helped thousands of seniors navigate Medicare. I've seen incredible success stories. I've seen people save thousands of dollars. I've seen retirees enjoy peace of mind and excellent healthcare coverage. I've also seen mistakes, some small, some costly, and some that allows people and some that follow people for the rest of their lives. Today's show is called the Medicare Mistakes Hall of Fame. These are the most common, most expensive, and most preventable Medicare mistakes we see every year. The good news, if you understand them, you could often avoid them. Today we'll cover enrollment penalties, enrollment mistakes, lifetime penalties, employer coverage misunderstandings, COBRA traps, Medicare Advantage surprises, prescription drug mistakes, HSA issues, doctor network problems, and real life case studies. So let's get started. Let us talk about Hall of Fame mistake number one. I thought Medicare was automatic. One of the most common mistakes I hear is I thought Medicare would just start automatically. Sometimes it does, sometimes it doesn't. And so the thing is, all our lives we've worked, right? We've had group health insurance, self-employed, gets individual coverage. And the thing is, really, no one tells us about how Medicare works, how we actually pay into Medicare, right, with our wages. And so either when you turn 65 or before then, or if you have family, relatives, friends that explain to you, or, you go to a workshop, it's just very different from these type of plans, right? From the under 65 plans. So, who may be automatically enrolled? So, generally, people already receiving Social Security benefits before age 65 may automatically be enrolled in Medicare. Their Medicare often arrives before they turn 65, which is pretty neat, right? Because I tell them, congratulations, because you already have your Social Security, you'll automatically get your Medicare red, white, and blue card in about 3 to 4 months before you turn 65. So no hassle there. You got that, right? So who often needs to apply? Many people who continue working and delay Social Security must actively enroll. Okay, so remember, these are the people that still want to stay on their group coverage plan, which defeats the purpose for applying for Medicare. But the Part A portion, which is just the hospital coverage, could supplement your group coverage, and that is zero cost if you worked for more than 10 years or 40 quarters, or if your spouse did. So that's something that's free. So why not take advantage of it? The Part B is the one that costs money, so people often delay that. Okay, so let's go over a real case study. A gentleman turned 65. He assumed Medicare would automatically begin. Months later, he discovered he was not enrolled. So now he faces enrollment delays, coverage gaps, and potential penalties, all because of one exception, right? Lesson: never assume, verify. So really the thing is like, oh, you feel like you turn 65, you get Medicare automatically, and that's not the case, right? So with this gentleman's case, he only just got around to it a few months later, right? So 4 months later. So just remember, when you turn 65, you could apply for your Medicare 3 months before, right? For an effective date, your birthday month. And then just make sure if you do, that doesn't mean when you apply, you get it at that point. It's basically still effective the first month of your birthday. But it's always good to just apply earlier just because sometimes Social Security could take a long time verifying and process your application, right? So you just don't want to be under the wire on that. So the earlier, the better. You do have 3 months after you turn 65 to also apply for Medicare. So let's just say you were born this month in June. So June, and then 3 months after would be July, August, September. So the last time that you could apply, like as an open enrollment per se, is end of September, when the effective date October 1st, without any special enrollment periods, right? So like usually special enrollment periods is like you left work, you retired, you got off your group plan. So that in would be a special enrollment, but at that time you will still have to like provide more verification that you had a credible plan, right? Because remember, if you don't have credible coverage, which is like a group plan, more than 20 employees, you will get penalized at 10% for every single year. So keep that in mind. Kind of went on a tangent, but if you are like on an individual plan, no plan or Medi-Cal, yeah, you have till that 3 month window after your birthday to apply. Because if you do not apply, and don't have a special enrollment period, what happens is it's delayed and you do have to apply come January to March of the following year. So keep that in mind. I have seen it happen. Two cases that I wanted to touch upon too is if you are on Medicaid or Medi-Cal in California, some people are like, well, I don't have to apply for Medicare because I already have free coverage, right? But keep in mind, Medicare is better than these low assistance programs. Okay. So I would apply, and you never know what the qualifications for Medicaid slash Medi-Cal is in the future. If you lose it, that means when you get off, there's a penalty, right? Because you never applied for Medicare. So I suggest applying, even though you are on one of those state programs. Also, if you are a veteran, some of my veteran clients are like, well, I don't have to apply. I have VA coverage, right? And those benefits, while great, and some, complain about it too, I would definitely still review your options, just because if the VA coverage changes or it's not as good anymore, you never know. Things could always change. At least you have Medicare to fall back on, which is great because you have more accessibility to other care, right? So keep that in mind when you decide, I'm not going to apply, right? So think about that too. Okay, so off on my tangent, let us go to Hall of Fame mistake number 2. Missing the Part B enrollment window. This is one of the costliest mistakes. What is Part B? Just to recap, the Part B is the medical portion. So that covers the doctors, the specialists, the outpatient services, the lab work, and the preventive care. The penalty: if you delay Part B without qualifying for coverage, your premium may increase by 10% for every full 12-month period you could have had enrolled but didn't. And so for many people, that penalty lasts for life. And you know what? Sometimes I get a new client and they get a letter in the mail from the insurance company. They're like, "What is this?" Like sometimes they never knew they even had a penalty, right? So yikes. Make sure that you just make sure that you are have Medicare, have Part B when you're supposed to, right? So real case life study: he retired delayed Part B because he felt he was healthy and never got around to it. 5 years later, he did enroll. Now he's paying a permanent penalty every month. So let's just say, let's calculate that, right? So 5 years times 10% is 50%. So right now, Medicare is 202.90 standard times 50%. He's paying $101 more in his Medicare. That is quite costly times 12. And that figure really just adds on every single year, which is unfortunate. So, lesson is Medicare rules are based on eligibility and coverage, not your health status. So, yeah, you may be healthy, um, right? But please just don't, just take care of it. Just please take care of it. Okay. So, let's talk about Hall of Fame mistake number three. I'm tied tongue today. The small employer trap. These mistakes surprise many people. Okay, so the question is, you continue working after 65. Should you enroll in Medicare? The answer often depends on your employer size. Okay, so large employers, generally 20 or more employees, many employees could delay Part B without penalty if covered under a qualifying employer plan. Okay, so just keep in mind, like you're pretty much almost safe if it's credible coverage over 20 employees. So for smaller employees, fewer than 20 employees creates a really different situation because Medicare may become primary. Um, so I wanted to dig deep in this because if you are with an employer that has less than 20 employees, while it could be credible, any group plan that has 20 employees or less, Medicare does become primary and your group health plan is secondary. But at that point, we got to look at the figures to see, does it make sense to even stay on your group plan? Because it might be costing you, or if your employer is paying for it, right? So it's really a comparison, a plan comparison. Is Medicare better than your group plan now? And that will really determine based by premium, deductibles, co-pays, co-insurance, max out-of-pockets, drug costs, accessibility to care, and the benefits in these plans. So let us talk about a real-life case study. A client remained on a small employer plan after age 65. He believed he already had insurance. And unfortunately, Medicare should have been primary. Claims became complicated and coverage problems followed. Okay, so this has happened to clients that I've seen where, let's just say you are on a group plan, less than 20 employees. Let's just say you had a surgery. So, went to surgery, you thought your group plan would cover it. Come to find, insurance didn't, the insurance company denies your claim because you're supposed to have Medicare first as a primary, right? So what these insurance companies want is you have the Medicare for primary and then they'll bill afterwards. So it's quite complicated. So please, if that's the case, get Medicare. And of course, we could help with that. So the question really isn't that simple, right? Do you have insurance? And the question is, how does Medicare coordinate with that insurance? I would say, yeah, that's like the biggest thing. How does it coordinate, right? Like I also had another client in where I mean, we did everything right. She was getting off her group plan, but she also applied for Medicare, right? But Medicare just took their time, dragged their feet, and let's just say like her plan was supposed to end June 30th, and she was applying for a Medicare effective date of July 1st. But let's just say, Medicare kind of messed up or just took a long time and made her effective date August 1st. And then so she stayed on her group plan for another month. But then that group plan was like, no, we don't want to pay your claims because you should have been on Medicare already. But in this case, I believe she fought it because it's like she did everything she could, but it was just Medicare that was giving the hold up. So things to consider, right? Some things are not as easy. I mean, some stuff could be easy, simplified, and so forth, but some are not. So just that's why call me, right? Because I will help you. Okay. Let us go over Hall of Fame mistake number 4, confusing COBRA with credible coverage. This mistake creates problems every year. Okay. So, what is COBRA? COBRA allows you to temporarily continue employee coverage after leaving employment. Many people assume if I have coverage, COBRA, sorry, I could delay Medicare. That assumption could be dangerous. Okay. So, real life case study, a retiree elected COBRA instead of Medicare. When COBRA ended, they discovered they should have enrolled in Medicare months earlier. Now they face an enrollment delay and possible penalties. Okay, so lesson, COBRA and Medicare follows different rules. Never assume one places the other. And so I just wanted to talk about one more case on this, which is crazy because I had a senior I was talking to. She basically called Medicare and asked Medicare, I have COBRA. Is that credible coverage and will I be penalized? That person on the end of that line said, yes, no problem. You will not be penalized. You're good to go. So she decided a year later that she would get on Medicare. When she applied, they basically was gonna penalize her the 10%, right? Because it's 10% for every single year that you're not on Medicare, that you had to be. So you get penalized, right? So what happened was she fought it. But the aggravation, the time spent calling her constituents in the government, calling the Capitol, trying to get this resolved, right? I mean, that's a lot of pain and anguishment. Like some people, honestly, would just probably give up. But because they were able to listen to the recording and they were wrong, okay, Medicare was wrong, they took back that penalty. But the aggravation, all that, I mean, is it worth it? Up to you, right? Because it is the principle of the matter. But to call the people you're supposed to call to give you the right answer sometimes is not. So if you feel inkling of like, does this person know what they're doing? Maybe they're new. It might be better to call someone that is certified and licensed, right? Like me. Okay, so I hate that story. Okay, let's go over Hall of Fame mistake number 5, ignoring prescription drug coverage. Many healthy people think I don't take medication, so I don't need Medicare, need Part D. So the problem is Medicare doesn't evaluate whether you're taking prescriptions today. The rule focus on whether you have qualifying prescription coverage. Okay, so the Part D penalty, if you go too long without credible coverage, you may owe a penalty. And like Part B penalties, it could follow you long term, lifetime, right? So, real life case study, a healthy retiree skipped drug coverage for years, that then a serious diagnosis occurred. Not only did he need medications, but he also faced a Part D penalty. So, classic example of this, to dig deeper, is I had a friend, her dad had a supplemental plan, never took any prescription drugs, didn't have a drug plan, didn't know he was supposed to have a drug plan. 10 years later, unfortunately, he had a stroke. And that stroke, the doctors prescribed him medication, which cost thousands of dollars, right? So what I did for him was I reviewed his penalty approximately versus the drug cost as a cash patient versus getting on a Part D drug plan. And it still behooved him, or cost wise, it still made sense to get on a drug plan. The lesson learned here is he definitely is going to pay for that penalty for the rest of his life, unfortunately. But hey, it is what it is. And glad that we're able to get him that drug plan at some certain portion of time. So this is what I do for people. I really try to dig deep in to figure out what's going on and to find you the best solutions to the issues on hand. Okay. So let us go over Hall of Fame mistake number 6, choosing a plan based on television commercials. We've all seen them. Commercials promising flex cards, grocery benefits, dental, vision, give backs. Those benefits may be real, right? They are real, but they don't tell the whole story. What I don't like is when they say, we'll give you $5,000 this year. Okay. No plan is giving that. And if they are, I'm telling you this, they're going to file for bankruptcy. They're going to go out of business and you're out of a plan. And it's just a scramble and a stressor. Okay. So there's caveats to these plans. Okay. So what people often forget is you must also evaluate your doctors, your specialists, hospitals, prescriptions, medical groups, prior authorization requirements, right? I've like they want these benefits. What happens is someone sells them a plan, they enroll, they find out their doctor's not even in network. They find out that they don't even qualify for their plan. It was like a Medi-Cal Medicaid plan, or you needed a chronic condition like diabetes, or heart condition. So please talk to someone that is an expert. Okay, so real life case study, a client switched plans solely because of an advertised benefit. Months later, he discovered the longtime specialist wasn't in network. The extra benefits wasn't worth losing access to the doctor. And this definitely happens, guys. A gentleman, he had like a surgery coming up and just couldn't do it, right? We had to change him back. And luckily there was some open enrollment periods that we were able to. So benefits do matter, but healthcare access matters more. Okay. So Hall of Fame mistake number 7, not reviewing plans annually. Many people say, my plan worked fine last year. That may be true, but plans do change. So things that change, networks, drug formularies, copays, premiums, medical group supplemental benefits. The plan that was perfect last year may not be perfect this year. Okay, I could probably go on and on that. Something to go over that too. Medical groups are definitely changing depending where you're at. Some of your drugs may cost more. That's what I've been noticing too. Some of your copays as well. Okay, so Hall of Fame mistake number 8 and the last one, the HSA surprise. Okay, so this catches many working professionals. Health savings accounts can be excellent saving tools. However, once enrolled in Medicare, you generally can no longer make HSA contributions. So a client enrolled in Medicare and continued HSA contributions. This later created tax complications. So, I mean, what a mess, right? So Medicare and HSA planning should be coordinated carefully. So please consult with me and I will help you. So in closing, the biggest lesson of all, there's one thing in today's Hall of Fame teaches us, it's this. Most Medicare mistakes are not caused by bad intentions. They're caused by misunderstandings. The Medicare system is complex, the rules change, and many people make decisions based on assumptions rather than facts. The good news is that most of these mistakes are preventable. Before making a Medicare decision, ask questions, verify information, understand your options, review your coverage regularly, because one conversation today can prevent years of frustration tomorrow. Thank you for joining me for Medicare 360. I'm Jennifer Alfonso Lee, and next time we will discuss how Medicare and Social Security work together, timing benefits, and common misunderstandings. Until then, stay informed, stay prepared, and remember, clarity always comes before coverage.